Hello, dear friends. Today I'm just going to start Burger Bonnie-Husson characteristic repertory, and the first topic I have today is nose. Especially, we will talk about Coryza. Understanding homeopathic point of view, we have to understand first the common things, because if we know common things, we can easily identify what is uncommon. So this is very important to understand the pathology first, and after that what is unique in that pathology. So that's why practice of medicine is very, very important here, and after that we can find out what repertory said in this situation. If we talk about pathology, every patient, whoever around us who have any respiratory, upper respiratory issue, they have few common symptoms. For example, if we talk about common cold, that is called viral upper respiratory infections. The first symptoms, if you see in these cases, are sore throat, fatigue, or lightheadedness. These three symptoms comes very quickly in few hours. And when the patient said, I will feel that I will get the respiratory trouble, I will get the coryza, this is pre-pathological conditions. And this, if you want to find out in repertory, this is called prodromes, and have almost 6-7 remedies are there in that in this case. Prodromes, open Pathak repertory, and you will get these symptoms. Next is within days or 2 days, the patient having 4 more common symptoms added into the first 3. First is runny nose. Second is nasal or sinus congestions. Third, coughing or fever. Within 2 or 3 days, the patient will get these symptoms. So these are particular. When person having after 3, 4, 5 days, and you will get patient says, oh doctor, I have lots of coughing. When the coughing is prominent, always remember, when the coughing is prominent, it means the infection is affecting the lower respiratory tract. This is not now up to the upper respiratory tract. And it may be involved in 2 forms. The bronchioles are involved, this is bronchitis, and if the alveoli is involved, then it may be pneumonia. These are the common symptoms, and everyone having these symptoms. Along with these particular symptoms, there are general symptoms. For example, in general symptoms, fever with chill, this is common. Muscle ache, painful muscles, this is common. Fatigue is common. Lightheadedness is common. This is common symptoms, and everyone having these symptoms. So now we will move to Boger Bonnie-Husson repertory. If you have it, just open it. We will discuss the first chapter, the Coryza. Repertory teaches us case taking, what we have to ask the patients, what we have to get from the patients. For if you see in Pathak Repertory, page number 282, Coryza is the chapter, and in Coryza, first they says a particular conditions, catarrh, Coryza. After that, Dr. Boning Hassan gave aborting repertory, aborting remedies which abort the Coryza very quickly. And after that, Dr. Boning Hassan write it down there, a remedy when the Coryzas come out, the whole general symptoms ameliorated. This is not an acute case, this is part of chronic case. Once Coryza start, all other general symptoms ameliorate. Only one remedy, Thuza, is here. Another very common thing is here when the infectious goes down. Person, we already discussed in common thing. Person, when the coughing is very prominent, it means the lower respiratory tract is involved. So here, descending into air passage, we have 4 remedies here: ammonium bromaticum, ammonium carb, justitia, and kali carb. These are the 4 remedies when the infectious start from the nose and descending down. So next we have a 2 type of Coryza: dry Coryza, fluent Coryza. Sometimes the patient doesn't have lots of mucus, but sometimes the person having a lots of mucus coming out. No mucus, lots of mucus. We have to differentiate into 2 forms. Another, what is common now? Common is that person having Coryza, person having lots of mucus coming out from the nose, and whenever person go out, patient relief. This is common thing. When person going outside, person get relief. This is common thing. But when the patient go out, if it is aggravated, this is uncommon. This is not common. This is not common. Person go out, if he or she relieved, this is common thing. But the person go out, it aggravate the condition, this is not common. And the 2 remedies are Ticurium maroverum and Thuza, 2 remedies. But when the person come at home inside, the Coryza, fluent Coryza, stop. Not coming out, nothing coming out. Go out, lots of mucus coming from the nose. When come back, no mucus, dryness of the nose. Then only one remedy remain, Thuza. Outside aggravation, inside dry nose, this is Thuza. If we see Boger Boning Hassan repertory. Another Coryza come, especially when Coryza relieve the obstruction of the nose. When Coryza start, obstruction relieved. Single remedy, lacosis. Lacosis is there. Then a very, very important rubric in Boger Boning Hassan repertory, page number 383. Patient having recurrent Coryza, very recurrent, very quickly, very easily. recurrent having different remedies, very easily recurrent different remedies, and both rubrics having a one common, three common remedies. First is Dulcamara, very recurrent coryza, very easily recurrent coryza. Second is Pulsatilla, then Cilicia, then sulfur. These four remedies come into both recurrent and easily. When the condition is recurrent, after a short time, the person having coryza, after a short time, person having coryza. Then stuffed, obstructed, feel congestion. The patient feel blocked nose. So there is a big difference between stuffed and obstructed, because both having written in the same rubric in Boger-Bonning-Husson repertory. Stuffed nose, when the person feel that I feel the nose is almost blocked, feel congestion, feel heavy in the nose. This is called stuffedness. And when the actually blocked person is not able to breathe. In stuffed, the person is able to breathe but very difficultly. But in obstruction, totally blocked. And uncommon is when the person go into open air, the nose blocked. What is common? When the person go out, nose opened. Nose open is common. Nose blocked is uncommon. And the remedies are Calcarea Fos, Naza, and Naxomica. When they go out, nose blocked. And next is which side he lie. If he lie into right side, the right side is blocked. If he sleep into left side is blocked. And the remedy is Calcarea carb. And Calcarea carb is having a recurrent, easily recurrent, small, slightest air, draft of air cause coryza in kids, anyone, very easily. Next is, doctor, I got the coryza, I take the medicine, and after that my coryza stopped. But now I have a ear problem, I have a eye problem, I have a headache, I have a respiratory problem. This is called suppressed coryza. And we have a wonderful rubric in Boger-Bonning-Husson repertory, and this is coryza suppressed, then eye trouble. After suppressing the coryza, eye trouble start, headache start, pectoral inflammation, pectoral muscles inflammations, or respiratory symptoms. These are few condition after suppressing them. Coryza with sneezing, lots of sneezing with. So we have now concomitants. Sneezing with headache. If you see in pathology, you will not find out these symptoms. Whatever is out of box, it means out of pathology, out of practice of medicine, these all are uncommon symptoms. Sneezing with headache, remedy is Cinna, just one remedy. Sneezing with nausea, two remedies, Agaricus, sulfur. Sneezing with neck pain, one remedy, ammonium muriaticum. Then, so these are the common condition and uncommon conditions. The first most important part of case taking is time. When this happened, when this condition was aggravated. So time, morning time, afternoon, evening, forenoon, night, when. Then the most beautiful thing in Boger Bonninghausen repertory is they give aggravation and amelioration after the chapter. So open air aggravation, walking in the open air and a person having aggravation. The remedy is taraxicum. And this is uncommon. Mostly when the person having coryza, they can go out, they get ameliorated. This is common thing. When person walk in the open air, the condition, the coryza is aggravated, especially walking time, then the remedy is taraxicum. But the person go out, come back, then aggravation, the remedy is opium. Person go out, walking, come back. When he come back, after the condition is aggravated, the remedy is opium. During walking, taraxicum, come back, aggravations, opium. After alcohol, bathing, take shower, nasal discharge, aggravation. Remedy is antium crudum. Then dry wind, spongia. Odor from sanguinaria. Reading aloud, verbescum. Sleep during, aggravation. Coryza, aggravation during sleep, this is pulsatilla. This is not lacosis or any other remedies as sleep during aggravation. So sleep during aggravation here is pulsatilla. Change of temperature, weather change, winter, aggravation, ammonium carb. Only few ameliorations. After perspiration ameliorations, only 3 remedies. Chamomilla, natrum carb, nux vomica. And so after that there is a concomitant. It means in case taking we have to find out what is going on. Then we have to find out the characteristic, then modalities, then we need concomitants. So pain in abdomen during coryza, 2 remedies, aconite and calcarea carb. So here calcarea carb too. So person having coryza, and parents always complain, doctor, very easily, he gets sick very easily, and this come very quickly. Every 10 days he is suffer from this condition, and whenever he has a coryza, he always having abdominal pain. So it confirm calcarea carb. Next, loss of appetite, no hunger, but other side lots of hunger. One is no hunger, other is lots of he is eating a lot. No appetite, phosphorus, lots of appetite, hypersulf. Then backache, breathing difficult, then chest pain, cheek redness, one-sided red, one-sided is pale, chamomilla, cough, earache, especially when suppress the discharge, nasal discharge. When suppress the nasal discharge, if there is any ear pain, then few remedies we have. First is arnica, belladonna, lacosis, mercan, very high grade in pulsatilla. But if the patient having lots of itching in the ear, then cyclamen is the remedy. eyes affected, face heat, these all are concomitants. Neuralgia. Then if neuralgia is there during coryza, the remedy is verbascum. Neck stiff, lacosis. Skin symptoms if come along with coryza, this arsenic is the remedy. Loss of taste and no thirst, throat crawling in, yawning, lots of teeth ache, vertigo, these all are concomitant symptoms. So go through nasal, especially the coryza, read every rubric. It will give you a wonderful experience of basic homeopathic. This is the basic book. That's why I started Boger Boning Hassan Repertory. Common and uncommon. First we have to know what is common, and after that we should know that what is uncommon. So this is all about today. Thank you.